Thank you for your patience, everyone, as we get the technical parts taken care of. Greg is very graciously recording this so it can go up on YouTube later on. So it's not being live streamed right now because we can only live stream one thing at a time, and they're live streaming in the sanctuary with Dr. Preby. So if any of you are thinking, oh man, I wish I could create a clone of myself, but I wish I could be in two places at once, you'll be able to hear Dr. Preby on our website afterwards. It'll be up there.
When you go get on the website,
Greg, it looks lighter. It's good.
Yeah, ready to go.
Okay. All right. Thank you. All right, so I just thought I would introduce Dr. Parrott, although she doesn't need an introduction for many of us. So we haven't talked about what to say. So I'm just going to ad-lib. So Dr. Parrott is a local physician, and she is a lifestyle medicine physician as well as an OBGYN. So you have a clinic, is it? And what's the name?
Healthy Choice Medical. It's in Tavares. It's just close here, from here.
Okay. And are you doing lifestyle medicine there?
Yes, I'm doing both lifestyle medicine and OBGYN. And by lifestyle medicine, I mean I'm not limited only to women. Now I do see men for some consults as well.
Okay, so that's really good to know, because you know, if any of us need any help in that area, Dr. Parrott's not very far away. You don't have to drive all the way into Orlando. Yes?
Does insurance cover any of your
That's a very good question. I'm sure you're hearing from this mic here. But that's a very good question. It can in some diagnosis, but I prefer not to need any insurance at this time.
So we'll have some time for questions at the end. So Dr. Parrott is going to be presenting food as medicine is the topic. So thank you all for coming, and thank you so much, Dr. Parrott, for coming and sharing your knowledge with us.
Well, I hope you can hear me. This is, you'll be able to hear well?
yes. Probably found
How
out
about now?
from the lady that was like, well,
Okay.
she's sending out texts.
So, my topic today is food as medicine. And as you know, I'm an OBGYN and board certified OBGYN and lifestyle medicine as well. So, I want to first kind of define what lifestyle medicine is, because a lot of people don't know what that is. So I'm going to spend a few seconds explaining what that is. And actually I'm quoting from the Foundations of Lifestyle Medicine Board Review, as a matter of fact. It says that lifestyle medicine is a distinct field of medicine aimed at treating the cause of most of our modern diseases with the strongest evidence-based modality available. And since modern diseases are caused by lifestyle changes must be part of the cure. So although portions of lifestyle medicine, especially nutrition and physical activity, are included in other fields of medicine, lifestyle medicine is distinct because lifestyle change is prescribed as the first line and most important therapy for disease treatment and reversal. So it is the first line of therapy. Evidence-based medication and other modalities are used, but only to supplement changes in lifestyle. So lifestyle medicine requires patient engagement and responsibility. You are involved in your care, in other words, for the best treatment outcome. Treatments is expected to be long-term. So a provider like myself, for instance, acts as both as a medical expert and a coach. We're both. Lifestyle medicine is cost-saving for our healthcare system, unlike most non-lifestyle medical services. So I'm here to talk about food as medicine. But let me tell you, there are 6 modalities that we use in lifestyle medicine, or 6 interventions, and they are nutrition, and we prescribe it: physical activity, sleep, stress management, and emotional wellness, avoiding risky behaviors, and social connectedness, or what we call positive psychology. So we use all of these as our intervention for lifestyle medicine. So today I want to talk about food as medicine. It was Hippocrates who made this statement: let your food be your medicine and your medicine be your food. And then comes Edison, and he said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. So these 2 great men say these things, and yet we're still doing the same thing. So why this topic then?
Increase your wealth.
So it's not, this slide here is a slide that tells us the most common preventable cause of death, and that's the back one, you can read it. So the first thing you need to know is that as doctors, we weren't given a course in nutrition in medical school. So far, there are about 10 medical schools that actually do this, so far. And in 2017, there was a JAMA article which says that 12% of visits to a doctor's office result in nutritional advice. So don't expect to get much nutritional advice from your doctors, because we weren't taught nutrition in medical school. In fact, if you are already diagnosed with a disease, such as diabetes or high blood pressure or even cancer, 1 in 5 will get any kind of dietary advice. I have been told by patients who have cancers that when they go to their oncologist and ask the question, what can I eat, what do I do, they were told you can eat anything. So it's a tough world out there when it comes to going to a physician office trying to get any advice. My experience and my epiphany came when, in this very church, as a matter of fact, this church was having a health fair, and I was asked to do a talk on breast cancer. Just before me, Dr. Guthrie was speaking about diabetes, and after the talk, I was able to speak with him, and he says, did you know that there's a college called the American College of Lifestyle Medicine? And I said, what? Is there such an animal? I did not know this. This was in 2000, probably 16. I ran home. I joined the American College of Lifestyle Medicine. I went to the conference that same year. I walked in a vegetarianish and walked out a complete vegan. The world of evidence, the amount of evidence was so overwhelming to me that I changed my whole course of my life, including my patients. So what I'm about to present to you today is a little bit of scientific evidence for food, the use of food as medicine. And what I'm about to say doesn't even scratch the surface of what's out there now about how food can change your life. Food can reverse disease. Food can, treat disease. Food can prevent diseases. So hang in there. If you see a little bit of graphs or charts or etc., those are just scientific evidence proving that indeed we can change your lifestyle by actually just simply doing good nutrition. So the most common preventable cause of death, as we know, is tobacco. But down the list, you see obesity runs right after that as well. And then, of course, the annual number of deaths by cause. We know this slide. There's cardiovascular disease at the very top. Cancers, respiratory disease, diabetes, dementia, lower respiratory infections. These are the whole list. But cardiovascular disease runs at the top, and this has not changed. It hasn't changed forever. So we're still battling that. I put this slide in there to show you that even in the Caribbean, we're not immune to this. Strokes, how many people die? And the reason why people in the Caribbean, I gave this lecture to the University of Georgetown, St. George's in Grenada. So I got this slide for them to show that that the Caribbean people are not immune to dying from cardiovascular diseases, and it's by flags here. The reason why the USA is so little compared to, say, Guyana is that the access to care is much different in these different regions of the world. So people die before they get any kind of intervention. That's what this slide is all about. In the Caribbean, we have another one that I wanted to show you, because I know there are Caribbean people here. Diabetes, 9% prevalence, and 70% of deaths in the Caribbean due to these 4 diseases, such as cardiovascular disease, cancer, diabetes, chronic respiratory disease. 16,000 per year died premature. I didn't make this up. This comes from the Pan American Health Organization, also known as PAHO. And I got that from their information. So, in 2017, there was a study that was done that looked at the systemic analysis for the global burden of disease. And they found this, a few things. What we are not eating is killing us. Dietary risks are responsible for 11 million deaths annually and 255 million disability life years. Cardiovascular disease is still the leading cause of death, followed by cancer, then type 2 diabetes. And here's what we are not eating. We're not eating whole grains, fruits, vegetables, nuts and seeds, and we're just taking in too much salt. This was a study that was done in 2017. So 45% of deaths from heart disease and strokes are due to suboptimal diet. And dietary risk is the #1 factor for chronic disease, even greater than tobacco. So the state of healthcare is like mopping up the floor while the pipe is wide open. We have 19% of our GDP is attributable to healthcare, which is equivalent to $4.5 trillion. And that's what we do. So our healthcare system, big agriculture, big farmer, is lining their pockets as we just get more and more diseases as we begin to eat more and more of the standard American diet. So our system wants us to, it really is a sick care. It wants us to get sicker and sicker, and so that we can do more and more tests and more procedures. It's like mopping up the floor while the pipe is wide open. It's not good getting anywhere. You can keep mopping the floor, but if the pipe is wide open, the floor is going to continue to get wet. So why this topic today? So here, because of all of that, here's what I'm going to talk about. I'm going to give you an overall view of nutrition. What are we eating and the science behind what we should eat. And if I have a chance, I'll deep dive into hormonal imbalances, like type 2 diabetes, fibroids, and even breast cancer as well, and heart disease. So foods can be divided into 3 categories. Some people call them classes. I like to say red light, yellow light, green light. And your health is affected by which class of food you primarily eat. So, your green life foods will be your green leafy vegetables, your colorful ones, your beans, legumes, lentils, you know the drill. Your vegetables, fresh fruit, whole refined, unrefined grains, your nuts, raw seeds, whole fats, and your beverage should be water. That would be your green life foods. Everybody knows that. Unprocessed foods, basically food that's grown. Okay? And we should try to do at least 80 to 90% of our foods from this category, from the green light category. But then there is the yellow light category, which is kind of processed a little bit. So the foods are like processed grains, even milk alternatives will be found in this because it's processed some. Eggs, cold water fish, so people put it in there, white meats, virgin oils, beverages such as fruit juices. So this is a minimally processed food. And I would put in there some of our meat substitutes as well, is in this category as well. And you want to do about 10, 20%, closer to 10% of your foods should be from this category. And then here are the foods you need to avoid. Avoid food that raises or promotes inflammation. It raises triglycerides, cholesterol, it increases insulin resistance, it increases the risk of diseases such as cancer. It should be completely avoided. If incorporated, it should be done very minimally. Very minimal. So you should avoid those. So your red light foods would be your refined grains, refined sweets, regular oils, your processed packaged foods, deep fried foods, red meats, processed meats, beverages such as sodas, and natural and artificially sweetened beverages. So, where do we get our information?
I'm sorry, could you pause just momentarily? He has to make an adjustment, and he doesn't want to miss anything in the recording. So that's a switch something. Thank you.
Okay, so where do we get our information about diet and nutrition? Where do you think you get your information? I have written down here some areas I think that we get our information from, like over-the-counter books and magazines and TV. You can get it from your doctor's office sometimes. Organizations like the Dietary Guidelines for Americans, ACLM, PCRM, Forks Over Knife, Center for Nutrition and Nutritional Studies, the Eat Lancet Commission. So these are some areas in which we get our information from to know about what we should eat. The guidelines, the Dietary Guidelines for Americans meets every 10 years, I believe, and they come up with what they think Americans should eat. And by the way, they have improved, and they don't have standard American diet on the guidelines, yet we do eat our standard American diet. If we were to do a systemic review and meta-analysis of 95 studies, a meta-analysis is when you take a bunch of studies, different places, and you pool them all together, and you show what, you kind of come up with a consensus of what it's showing. So they took 95 studies worldwide to show a dose response to lower the risk of cardiovascular disease and all-cause mortality. And they found that if you eat each 2.5 serving of fruit and vegetable decreases the risk of coronary heart disease by 8%, stroke by 16%, and all-cause mortality by 10%. Each 2.5 serving. A serving of fruit is one small fruit, or a serving of beans is a half a cup of beans. Serving of raw vegetables is 1 full cup, 1/2 cup cooked. And the benefit is dose related. The more you eat, the better your protection. And the benefits continued up to 10 servings a day. So for people who say, I can't do fully plant-based, you can be plant strong at least, because here's the research that shows that each serving reduces your mortality. So Eat Lancet Commission involved the work of several scientists from 16 countries, and it tries to answer the question, what is the best diet for health and human beings and the planet, taking into consideration sustainable food sources? That's what it wanted to discover. And they found a couple of recommendations. They recommend half of your plant intake should be non-starchy vegetables, that's green leafy vegetables, and the other half should be plant proteins, whole grains, plant fats, and minimal or no added sugars. This is not a church. This is the Eat Lancet Commission. This was commissioned by, I believe, the World Health Organization to do this study. So in any doctor's waiting room, you always find a large group of patients, but with a small group of diseases. And the small group of diseases are obesity, hypertension, type 2 diabetes, atherosclerotic vascular disease, asthma, Crohn's disease, inflammatory joint disease, and autoimmune disease. Everybody has this. Small amount of disease, large amount of patient. Any doctor's waiting room, you could just pick it out. You will find one of these diseases there. And you know what we say about these diseases as doctors? What they taught us? Etiology unknown. Meaning, we don't know the cause. Really? Is it really etiology unknown? The common thread that runs within every one of these diseases is inflammation and oxidative stress. It's the food. It has always been the food all along. So as a matter of fact, it has been scientifically proven that every one of those diseases can be reversed and placed in remission. I want to stop here a second and define what I mean by remission or reversal. It really is a remission of clinical symptoms, and all diagnostic and lab tests are reversed to the normal limit without the use of medication and no present signs or symptoms of the disease. That's what we mean by reversal. So in 1980, the AMA put out this statement. It says, a physician shall continue to study, apply and advance scientific knowledge, and make relevant information available to patients, colleagues, and the public, and obtain consultations and use the talents of other professions when indicated. Withholding this information from our patients are unethical. So your physician should be studying and learning and telling you stuff to improve your health. Withholding that is unethical according to the EMA in 1980. They made that statement. So I wanted to discuss several studies that were done to prove that what we eat and our lifestyle that we keep improves our health and longevity. And the first is the blue zone. Okay, there we go. The blue zone. The blue zone in 2009, a researcher by the name of Dan Buettner, he published his work on 5 areas of the world that has the highest centenarian. They lived until 100. Very easy and moving. And they had a few things in common, and I want you to listen to the things they have in common so that you can actually create your own little blue zone around you. Their food was plant-based. By the way, they weren't vegans. Their food was plant-based, however. They moved naturally. Didn't take a car. They were walking or riding a bicycle. They lived in communities. They did not overeat. They had ways to shed their stress. And they live a life of purpose and social networking. So they had social connectedness. So these blue zones were Ikaria, Greece, Okinawa, Japan, Ugly Estrata region, Sardinia, Loma Linda, California, and Nicoya Peninsula in Costa Rica. They were 95% plant-based. They eat 3 to 5 servings of meat per month. They eat 1 cup of beans daily. They eat whole grains, they eat nuts, and they drink water as a beverage. That's the blue zone. Those are the blue zone. Then there's another study, the Adventist Health Study, both 1 and 2. The Adventist Health Study 1 looked at 34,000 people. During the period of 1978 and 1988, they looked at Seventh-day Adventists. The Adventist Health Study 2, looked at 96,000 patients. It started in 2002 and is still going on. It's a prospective cohort study of Seventh-day Adventists. The study is still going on presently, and as you know, most Seventh-day Adventists are vegetarians and they do not drink or smoke any alcohol. And here's a key finding that they found with this Adventist Health Study. Vegetarians have a lower risk of cardiovascular disease, hypertension, and high cholesterol, and also type 2 diabetes. They also have a lower risk of cancers, such as ovarian, colon, prostate, lung, and bladder. They also have a lower risk of degenerative joint disease as well, or arthritis, as well as soft tissue disorders, and all risk factors and disease incidence were further improved with a vegan diet. In other words, the Seventh-day Adventists who are vegans, compared to the lacto-ovarian, their numbers are even better. So that's the Adventist Health Study. Then there is the Oxford Vegetarian Study, which was done in 1999, and it was a prospective study. And they found that vegans had a lower LDL and total cholesterol compared to meat eaters. So, and they looked at all-cause mortality, especially with ischemic heart disease, and all of them were actually less in patients who are vegans. Then the EPIC study, which was done in 1992, EPIC means European Prospective Investigation in Cancer, and that was done in 1992. They looked at 500,000 people in 10 countries in Europe. And overall, they found that the vegetarian group had lower cancers, and if you were a vegan, you're on lacto-ovo-vegetarian, you had a 32% less chance of developing cardiovascular disease than those who eat fish or even meat. So that's the EPIC study. Another study, just to round it off, is the Nurses' Health Study and the Health Professional Study. They looked at physicians and nurses. And this was done from the NHS, and they looked at 121,000 female nurses in 1976. And they found that the Health Professional Study looked at 51,000 male nurses, and they found that they saw an increased risk of type 2 diabetes in those who eat meat, specifically processed meat. And if you eat more than 5 eggs per week, it also increased your risk of type 2 diabetes as well. So those are some studies that prove that a plant-based diet gives you better health, less cardiovascular disease, less improved longevity, and just an overall healthful way of living. So when we eat food, we get calories from fats, from proteins, and from carbohydrate, but the part of food that has no calories, vitamins, minerals, antioxidants, and phytochemicals, you get no calories from that, but that's where you get your protection from your disease. So the first portion gives you calories, the second portion no calories, but your protection comes from the part of the food that gives you no calories at all. So your vitamins, minerals, antioxidant, and phytochemicals, which brings me to principle number 1. You want to eat foods high in micronutrients and low in calories. For instance, if I go on the treadmill and I walk for 30 minutes, I would use up maybe about 130 to 140 moderate walking calories. But if I eat a cookie is maybe 180 calories. So you know how much I have to walk to burn up 180 calories because of the fats and the saturated fats in the cookies. You just not eat the cookie, and now you have lost 180 calories. You see what I'm saying? So you want to eat foods high in micronutrients and low in calories, and you can only get that from plants, high and unprocessed plants. And Dr. Furman said it in a really nice way. He said, moderate calorie restriction in an environment of micronutrient excellence. Couldn't say it any better. So when you put food in your mouth, what you put in your mouth makes you who you are, both physically and emotionally. The structure of the cell membranes, the elasticity, the tensile strength of your cartilage, the elasticity of the blood vessels, and the interior of the cells, everything we put in our mouth affects these things and count towards determining your future health. Now, grapefruit is a powerful fruit. It's actually one of my favorite fruit. But grapefruit, and I like it because it looks yellow. I'm very visual in my eating. So it's big and yellow, so I thought, I've always liked it because it was yellow. This picture is a picture of my grandnephew, let me see, I said that right, on my farm that I was brought up on. It now has grapefruit. So grapefruit, half a grapefruit will give you 52 calories. 1 gram of protein, 13 grams of carbohydrate accounts for 64% of all the vitamin C you need for the day. Fiber, 2 grams. Lots of water in it. It has potassium and magnesium as well, and vitamin C, which supports your immune system. Now, some people may not like the taste of grapefruit because it's a little bitter, and there are things that you can do with it to kind of reduce some of that. You can put maybe a little sweetener on it and put it in the oven, and put your oven on broil and broil the grapefruit, and it really brings out all of the sweetness of the grapefruit. You can actually chop it up, put it in the refrigerator, chill grapefruit, reduces some of the bitterness. You could add some spices on it, like cinnamon and nutmeg, etc., to make it more palatable. As I said before, grapefruit is a powerful fruit, so if you have high cholesterol or high blood pressure and certain other kinds of over-the-counter medication, grapefruit can interact with that. And the way it does that is it affects the enzyme that cause the breakdown of some of these medications, so that now you take Lipitor or simvastatin or an antihistamine or a calcium channel blocker, and grapefruit would increase the potency of these medications. So because it prevents the breakdown, so this medication stays in your system longer. So if you want to eat a piece of grapefruit, you have to wait a little while, maybe 3 to 4 hours, before you can actually have a piece of grapefruit. Make sure some of that drug is metabolized. And if some people say that just eating grapefruit a day can reduce your blood pressure, it is because it has quite a bit of potassium in it. But I say you still follow the recommendation of your doctor. So I put this slide in here. I'm not going to read everything, but here is the things that happen to our body when we eat meat. All of these things happen. It can oxidize, and it can oxidize your cholesterol. It can create aldehydes. It can create inflammation. But you see that thing that says TMAO? Something kind of new. It's formed from red meats and cheese in the gut, and actually our microbiome is what causes that. But the important thing is that it causes uptake of cholesterol, and it's very atherogenic. So when we eat animal products, this is what happens. So how do plants, however, prevent disease, especially cardiovascular diseases? It prevents it by replacing some of the bad foods that we eat. It reduces LDL. It improves endothelial function. It reduces inflammation. It benefits the gut microbiota. It lowers your blood pressure via high potassium in some of these foods, and it decreases all of your lipids. So there are several ways in which eating plants would improve our health, and actually what it does for us. What is the number one source of calories in the US? And number one actually is desserts. 70% of our calories come from processed or ultra-processed foods. Here's the 5 top. But the number one actually is desserts, cakes and cookies and all of that. Refined white flour with sugar in it and butter. That is where most of our calories come from. High-density calorie foods. So I grew up on a dairy farm, by the way. My parents had cows, and we milked it commercially, and we sent the milk to the Nestle company that made all of the milks and the chocolate and everything. And now my parents are gone, and they're probably rolling in the grave saying, here I am talking about no milk. And milk is what brought me to medical school. So that's another story, but this is what we do now. This is what we used to put the milk in. But here's what we do now, pumpkins. Because pumpkins is rich in vitamins, fiber, antioxidant. It can boost immunity. It's good for weight loss. It protects your eyes from the flavonoids, and it reduces your risk of certain kinds of cancer. This pumpkin is actually real. It's not a stock shot. It comes from my farm in Trinidad. And this is the real farmer. This is my brother-in-law doing all of the tractoring on our farm. So, from the dairy to the veggies. So, what are some of the evidence for reducing hyperlipidemia? We know, when I was in medical school, they told us that we should tell our patients to eat, if they have high cholesterol, to reduce saturated fats. But nobody told us what to tell the patient to eat. So we tell them to reduce saturated fats by reducing cheese and eggs and red meats, etc., and sugars and alcohol and oils and fats and no fried foods. We told them the whole story. But we never told them what to eat to reduce cholesterol. And here's what you eat. Polyunsaturated fat, such as nuts and seeds, can reduce it for you. 1 ounce of nuts a day will do that, especially walnuts. Increase in dietary fiber will do it, like soluble fiber, especially from whole grains, from legumes, from fruits, from vegetables, can also lower your LDL by binding to the bile salts in the guts and promote cholesterol excretion. So if you eat beans, which, by the way, has quite a bit of fiber in it, it can bind some of that cholesterol, and then you excrete it. So just eating beans will lower your cholesterol level. And here's the mileage you get. This is some of our watermelons and pumpkins, by the way. The mileage you get from just from adding plants. If you go on a semi-vegetarian, you can reduce your lipids by 10 to 15%. Vegan will do it up to 20%. But if you're a vegan, you add much more fiber, nuts, and soy to a vegan diet, or even a vegetarian diet, you can increase that number to up to 35%. So you see, it's more you eat, the better it is for you. Your diet should also be hormonally balanced as well. Hormones, specifically insulin growth light factor 1, and estrogen. If exposure becomes too excessive, can lead to increase in angiogenesis and cell proliferation. This increases the risk of tumors such as breast and prostate cancers, even uterine fibroids and other estrogen-loving diseases such as endometriosis and autoimmune diseases, etc. I put that one in there because, well, I do women's health and my brain thinks women's health. But so your diet has to be hormonally balanced as well. Okay, so principle number 2, eat a hormonally balanced diet. And you can only get that from high fiber foods, nuts, seeds, whole grains, green leafy vegetable, your beans, the things that we have been talking about. Now, insulin cannot get into cells because lipids are deposited within the membrane. So this is a little picture here, complicated a little bit, but let me explain it to you about insulin resistance. Insulin behaves like little doors that opens up these cell receptors so that glucose can go in. So insulin allows glucose to go into the cells so that they can be metabolized. But if you are eating quite a bit of saturated fats, these receptors get clogged and insulin cannot do its job, so the glucose remains outside of the cells, and now we have prediabetes, or you have diabetes, or insulin resistance and diabetes. So insulin cannot get into the cells because lipids are deposited within the membrane, and insulin acts as a key or a door to allow glucose to enter the cells. Due to high lipid, insulin cannot work, so it accumulates along with glucose outside of the cells. That's insulin resistance. And by the way, that can be cleared up just by changing your diet. And that's how we know that prediabetes can be reversed, and even type 2 diabetes can be reversed, simply by unclogging these insulin receptors. So in the US population, there's 1 in 3 have prediabetes and probably don't even know it. Prediabetes, you may do a hemoglobin A1C, and the hemoglobin A1C is 5.8. That's prediabetes. Or from 5.2 to, I think, to 6 to 5.9 is prediabetes. And 88 million people are walking around not knowing that they have prediabetes. 1 in 10 is diagnosed with type 2 diabetes, about 34 million. In the world, we have 422 million diabetics. So it's a problem, and the prevalence of diabetes is about 8.8% in the world, and is expected to go up to 12.5% in 2045. So in 2025, the World Health Organization is trying their best to try to see how they can change those numbers. So it's mainly because of our diet. So the risk of diabetes per each serving. If you eat processed meat, it will increase your diabetes by 37%. Red meat, 17%, and if you just add some more sugar, 21%. All animal proteins are linked to type 2 diabetes. And in the EPIC interactive cohort study, which looked at 12,000 adults over a 12-year course, they found that 22% had an increase in type 2 diabetes at the highest quintile of protein intake. The more protein there is, higher the diabetes. More animal protein, that is, the higher the type 2 diabetes. So if you substitute this is the part that I really like, because you don't have to be a vegan nut like me and just change one day and become a completely plant-based, but you just need to substitute. If you substitute just 5% of animal protein for plant protein, there's a 23% decrease in your risk of diabetes. That is hope there. So what food is the most protective of type 2 diabetes? Does anybody know? What food is the most protective of type 2 diabetes? Anybody have a guess? Shout it out if you have a guess. No. Well, the answer is actually whole grains. Whole grains, not processed minimally, whole grains. Because whole grains improve postprandial glucose response, it lowers calorie density, it increases satiety, it is metabolized by the gut bacteria, and the gut bacteria produces a short-chain fatty acid that actually bathes the colon cells and prevents you from getting colon cancer. That's whole grains. But you see this GLP-1? Have you heard about that recently? GLP-1. GLP-1, it increases GLP-1. GLP-1 is the same thing as an Ozempic and all these medication that's used for weight loss. They're GLP-1, they're glucagon-like peptide, and they actually got the GLP-1 from the lizard, the Gila monster. They extracted from them. That's Ozempic. But our body actually produces it. So that's where they got the idea from. So when you eat whole grains, you get more GLP-1 and you're really nice and satisfied. So when somebody takes Ozempic, this is what patients are telling me, they have no craving for food. They kind of like, they have to remind themselves to eat. And that's how you lose weight with it. So anyhow, it improves insulin sensitivity, it reduces inflammation, and improves mitochondrial function. The mitochondria is a little battery within the cells that actually produces your energy, very important for energy and regulating your body. And whole grains does all these things, it's very protective. So this is, I'll skip this slide. Anyhow, there's a complicated pathway between insulin, fat, and cancers, especially breast cancer. Let me go back to the slide to show you how obesity can cause breast cancer, because it causes aromatase activation. Aromatase is an enzyme that actually makes more estrogen and therefore more cell proliferation, and angiogenesis means more blood vessels and therefore increase your chance of breast cancer. This is basically what this is saying. Is saying that more estrogen, more insulin growth-like factors, more inflammation, and more chance of getting certain kinds of cancers. It is much more complicated than this, but you just have to take my word for it on that. There is another slide that actually shows how estrogen is associated with uterine fibroids. So eating smart is one of the most powerful weapons in our fight against any kind of disease, especially for women, fibroid tumor. Consider going dairy-free if you have fibroids. Low plant-based, eat plant-based, I should say, I've said that. Liberal amounts, eat the rainbow, low glycemic foods, high in fiber. Avoid all processed foods, avoid saturated fats, choose foods that are free of pesticide and antibiotics, etc., the usual thing to reduce any kind of disease. Sugars, how much you should have. You really have quite minimal or none at all, but this is the recommendation from the AMA. They said you should do 6 teaspoons of sugar today for women and 9 for men. It's kind of a lot of sugar. But that's what it said, the AMA said. And then salt, WHO said 2,000 milligrams, just about a teaspoon or half a teaspoon, thereabouts, of added salt. This is added salt. And of course, the 6 teaspoon and the 9 teaspoon is added, not what's in an apple. It's just added. Okay, added sugar and added salt. I put this one here to show you that a Coca-Cola 20 ounces has 15 teaspoons of sugars in it. 1 can, 20 ounces, 15 teaspoons of sugar. And most Americans can consume about 23 teaspoons of sugar a day. But the AMA says 6 for women, 9 for men. So stress, this is just related to the fibroids. Okay, all right. Now what about fruit? Is fruit your enemy? Especially if you're diabetic? Well, this little study that was done in China looked at this question. They followed at least, for about 7 years, they followed people who are not diabetic as well as people who are diabetic and how much fruit they eat. So they were followed to look at fruit consumption and the incidence of diabetes and vascular disease associated with the diabetes. And they followed them for about 7 years. And the adults who had daily fruit consumption had a 12% decrease in the risk of developing diabetes. You can actually improve your insulin resistance with fruit in the morning, but it has to be fruit with fiber on it. For instance, if you take a big bowl and you chop it up with fruits and you sprinkle 2 tablespoons of flaxseed over that, gives you a little extra fiber, and it will actually improve your insulin resistance and improve your diabetes. In those who already had the disease, or already have diabetes, that is, and had fruit 3 to 4 times per week, they lowered all-cause mortality by 17%, and even the microvascular and the macrovascular complications of diabetes were also reduced as well. So fruit is not evil, and if you're diabetic, you can eat fruit. You just have to eat the whole fruit and eat it with fiber as well. So principle number 3, one diet, many benefits. One diet, many benefits. So follow a whole food, plant-based diet. The benefit, it will prevent, reverse, and treat your chronic disease for you. So what about supplements? I added, this is an extensive thing, but it's not for everyone. I added it for some people with certain kinds of diseases. But some people who are very relatively healthy, what you may need is probably, if you are kind of fully plant-based, you may need B12, and you may need some EPA and DHA, or omegas. If you have PCOS, you may need inositol, you may need zinc, you may need vitamin D. If you have COVID, or you're trying to prevent COVID, you may need NAC. But mainly, you should get all of your vitamins and phytominerals and phytochemicals from your foods. Vitamin D can be checked by your physician. So you should have it checked and see what your numbers are. You should have it in a range anywhere between 50 and 70. So this is not a list for everyone. It's a list for people with certain kinds of diseases. For instance, if you have fibroids or hormonal imbalances, the myro and chiro inositol if you have PCOS, etc. So what should your plate look like? So 50% vegetables, fruits, example, dark green leafy vegetables, your broccoli, your squash, and more. 50% of your plate should be your fruits and vegetables. 25% should be your proteins, legumes, your peas, beans, edamame, tofu, nut seeds. Another 25% should be your whole grains, barley, brown rice, buckwheat, quinoa, or amaranth. On water for hydration, when we look at the guidelines for American, they have dairy as the hydration, but it's better if you have water as your hydration. And water mixed with fruit, etc., like a Fresno type of thing, is really good, or lemon. So here's your homework. You may have seen this already, the plant-based documentary you watched today, that's your homework. And then there's a poem on food as medicine. Food is not just a fuel for the body, it can also heal and nourish the soul. It can prevent and reverse disease and make us feel alive and whole. Some foods are better than others. They have more power and grace. They can activate our defenses and slow down the aging pace. Beans are one of those foods. They are rich in protein and fiber. They can lower cholesterol and blood pressure and boost our immune system fire. Oil is not one of those foods. It is high in fats and calories. It can clog our arteries and veins and increase our risk of disease. So let us choose wisely what we eat and listen to what the science has to say. Let food be thy medicine and medicine thy food, as Hippocrates once did convey. So our take-home message today is this. It is never too late to start. Start as early as you can. Make small changes, make a difference. Add rather than subtract. I want to stop here 1 second and say, when I first, in 2016, when I got this whole new knowledge and I went back to my office and I started telling patients what they should eat and what they shouldn't eat, and I got really passionate about this, I had some patients leaving my office crying. It's almost as if I have told them, give me $1 million. I'm telling you to eat certain foods, and it was very difficult for them. So then I began to say, okay, I can't really say don't eat this or don't add that. So I began to say, add this and add that to your diet. And so I would tell them, add 1 large salad to your diet. Start slow, add 1 large salad per day to your diet. So this is how I came up with add rather than subtract. If you add more, eventually your tastes change, and then you notice that you're going to be eating more plants. So add more. Food as medicine is the future of medicine. I believe that because I think we cannot continue, or healthcare costs is skyrocketed, and we cannot continue doing that. We got to actually take care of your health. Self-care is healthcare. Save money on medication and reduce side effects. And a lot of people think that when they go on, if they eat more plants, that it is more expensive. Actually, it's not at all. It's actually cheaper. It has been proven over and over that if you do plant-based, it's cheaper than actually if you eat an animal-based diet. And of course, we can contribute to planetary health and the welfare of our planet if we eat more plants. So I want to open up the floor now for questions. Oh, yes. I don't know if we have a mic or we could say it. Or...
Yeah, the mic that he gave me for roaming is the one that you have.
But you could use it.
I don't know whether, can I go
Yeah,
back?
yeah. Mm-hmm.
Okay. Just a second. Perry, did you have? Okay.
Inflammation, what would be some of the best foods for like arthritis and inflammation of that way?
Well, I want to say... I want to say that there are some people who have, you've heard about the nightshade vegetables and stuff like that, and there are some people who are, they can become very, it can become very painful to them, so you have to know which food. Generally, if you don't have a problem with nightshade, any plant food will reduce inflammation, especially green leafy vegetables. Especially green leaf will do that, will reduce inflammation for you. But there's also turmeric and ginger. You know, those are the kind of foods that also would reduce inflammation as well. Now, there are some people who have problems with nightshade vegetables, and you have to kind of know which one will do it for you, which one causes the pain, and then you stay away from it. But generally, most plant-based foods will do it. Stay away from dairy. Dairy does increase inflammation much more.
Okay. Okay, Tim went to see where a roaming mic is, so.
I hope this is the easy one. You were saying 50% veggie and fruit, 25% protein and fiber, and I missed the other 25%.
Whole grains, I believe I said grains. So, yeah, it would be like your rice it'll be like your rice, so quinoa, you know, in that section. Yeah.
Oh. Greg, are you saying, oh, that I can turn it on? Hold on just a second. Okay.
Okay. Question.
Okay. Okay. I'll let you go.
I've got 3 whatabouts. What about fish oil?
You have what? Excuse me?
Fish oil.
Fish oil?
Yes. Omegas?
Well, there's a historical thing here, that's why historically, when it first came out, we said, oh, this is wonderful, fish oil is great. And then we realized after a while it was not the best thing, and some of it was getting a little bit rancid, and it was causing more problems than we had wished it didn't. So no, but omegas are still good, and omegas are actually good for inflammation as well, but preferably from a plant source. And you got to understand that fish doesn't make the oils. Fish eat algae, and then they get the oils from what they eat. So we should get it from a plant source. Best omegas from a plant source is actually seeds, flaxseed.
Okay, and what about honey for sugar?
Honey?
Yes.
You ask really hard questions, but that's very good. Honey, you could use a little bit of, some people are so plant-oriented that they don't do honey, but you can use some, but just remember honey is sucrose and glucose. It's still sugar, so you have to be still very careful with the amount that you use if you're diabetic.
Did you have one in there? If you think of it.
Thank you.
Okay, question?
Is extra virgin olive oil as healthy as it's made out to be?
Is extra virgin olive oil,
Is it as healthy as it's made out to be? Yeah.
it's one of the, it's the better option that we have, okay? But you have to remember also the fat you eat is the fat you wear. Okay? And fat is fat. So if you take a teaspoon of olive oil, well, 1 teaspoon of fat would have 9 calories, and it's the same if whether you coconut oil, olive oil, sunflower oil, or they're all the same. So you're really still very careful. With it, you want to use as little as you can, and if you have heart disease, you want to use almost none, and olive oil. Even olive oil, if you have heart disease, you want to use very minimal oil at all. Even olive. Even olive oil. Yeah, there is olive oil with a Mediterranean diet.
Okay.
But do you understand that the protection that they got from the Mediterranean diet was not the olive oil, was the fact that they were eating a lot of fruits and vegetables and whole grains. That's where they got the protection from. And it was not really said that way, but that's where the protection came from.
Okay, going back to the fish, how do you know whether the fish were farm raised or a wild caught in order to get the kelp? Because farm raised fish are not fed kelp.
That's right. So if you go to Publix, they will say farm raised. They tell you it's farm raised. And they feed them certain things. I don't know what they feed them to give them, for instance, salmon, to give it a pink color. But remember that fish doesn't make they eat algae that has the oils in it. So we're getting the oil secondhand. Yeah. And if you want good omegas, flaxseed has quite a bit in it. Quite a bit. And not the seed. You have to grind it up, by the way. Yeah, the meal.
Is hemp as good as flaxseed?
Yes.
Okay,
So you want nuts and seeds, hemp, chia, flax, sunflower, pumpkin. You want to do nuts and seeds on a daily basis, as a matter of fact, 1 ounce per day. Flax seed, hemp seeds, chia seeds, nuts, sunflower seeds, pumpkin seeds, sesame seeds. You know, you want to do nuts and seeds. You want to include nuts and seeds in your diet. As a matter of fact, there are some vegans who don't include enough nuts and seeds in their diet, and the problem with that is that they have low omegas. And so you want to include nuts and seeds in your diet. You want to include enough.
I was going to say, I think I remember Dr. Michael Greger saying that regular, like the oils, like free oils, they are high in omega-6s, basically. Mm-hmm. And those are not that good for us, right?
That's correct.
And so that's why
we need to try to avoid those as much as possible and get more of the omega-3s.
Right. You know, in the Caribbean, they have the coconut, and it's a big fruit, and it's high up in the tree, and then you have to develop a tool to cut it open and get to the white part and cook it down to make coconut oil. I believe God did that. To make it so hard, and we did it. We actually got up there and found a thing and chopped the coconut open and made all that coconut oil. Coconut has, of all the plants, has a lot of saturated fats in it. That's fat. Yeah. You know, olive does not have saturated, well, it has some, only 14%, but it has mostly unsaturated fats. That's what olive oil is better than, say, coconut oil. But coconut oil has saturated fats in it, just like butter. God put it up in the tree, and you have to climb the tree and take the big coconut and then let it dry, and then get its tool to cut it open, and then there's all this fiber around it, and break the nut, and then dig the thing out, you know about it, dig it out, grate it to make the oil. All those steps, right, Margaret? To make that good. That's a lot of work to get heart disease.
But isn't the coconut...
That's different.
The coconut water...
That's different.
Okay.
The coconut water is different because the coconut water is almost like IV. And, you know, the coconut is not a bad fruit or nut. It's not a bad nut. I'm just saying the oil is bad. Yes.
I've read that coconut oil is good for people who have dementia, that if they take a teaspoon or a tablespoon each day, it helps with dementia. Is that not so?
Well, I'm glad you raised that because you have to go back and look at that study. It was one person, and then it made this whole industry about coconut. Not saying that coconut, you know, listen, I use coconut, you know, the dried coconut, you may put it on desserts and stuff like that, but I try not to use as much coconut oil as I can. But it does taste good, I gotta tell you. Does make some curries taste pretty good. So, but yet, I've heard that too, I've read it, but when you actually go back and look at, when they actually examined how that came about, that thing that you're talking about came about, was actually one person, one woman who had a husband who had dementia, and she did that, and somehow he got better, and that went like wildfire. That's how that study came about. That's how that came about. So it wasn't anything scientific at all.
Yes, and you did mention about diabetes, okay? You talked most about diabetes, but as a vegan, having a problem with your hemoglobin being a pre-diabetic, trying to balance that, how can you expand on how we can more?
Okay, very good. That's a good question. I'm glad you raised that. So here's what I think you're asking. Are you asking, as a plant-based person who may have pre-diabetes, how to manage it? Is that what you're asking? Okay. So now there is healthy plant-based and unhealthy plant-based. Okay? Right. There's healthy plant-based and unhealthy plant-based. I know some vegans who are overweight. And you know, it was Dr. McDougall, he wrote this book called The Fat Vegan. It was funny. He's a very funny guy. Very mean, but very funny. McDougall, The Fat Vegan. When he talks about, he gives a whole lecture on the fat vegan. But here's the point I'm making. Sugar is vegan. White flour is vegan. You understand what I'm saying? So, but if you center on completely whole, unprocessed food, you will get that hemoglobin A1C down. has to be whole foods, has to be unprocessed foods. And you'll get it down. Because I'm telling you, you can be an unhealthy vegan. You know what? They did some studies on that very thing that you're talking about, and they found that the unhealthy vegan, their chance of getting disease is worse than if they were to eat regular food. Because you're eating cookies, white flour, sugar, sugar-sweetened beverage. They're all vegan. Everything I've called there is vegan. But it's unhealthy vegan. And not eating at all, not eating enough plants, or not eating enough green leafy vegetables, etc.
Okay, so switch it to plant-based for a
Yes.
plant-based person.
Yes,
now.
unprocessed plants.
Yeah,
Yes.
the unprocessed. Yeah,
Yes.
for unprocessed. Would you say, being that plant-based person, being very strict in what they eat, eating a lot of fruits, would that help to increase the diabetes or
No,
the
fruit.
borderline,
Remember,
or is
I
it
said fruit is not evil.
Is
No,
it-
fruit is actually pretty good for
pretty
you.
good? But what probably could be causing this borderline diabetic disease to come on?
Two things. I don't know this person individually, so I don't even know your case completely. But there's an unhealthy plant-based that you could adopt. But there's also other things that can cause diabetes too. What if the person has a type 1 or type 1.5, something like that? You see what I'm saying? So lots of things need to be checked out before you can actually say, okay, food is completely responsible. If it's a type 1, food can help, but there may be other things that can also help as well.
What's type 1 versus type 2?
Okay, well, type 1 diabetes can occur when the cells of the pancreas die because of autoimmune reaction, so that now the person really needs, because they have no more cells producing insulin anymore. See what I'm saying? They have no more cells producing insulin anymore, and therefore they need insulin. So what if that person is developing an autoimmune reaction to, etc.? So it's a little bit tricky, but if you're dealing with somebody who is strictly on a food basis, you just change to a completely whole food plant base, that goes away. And it can go away very quickly. 21 days. You can get that to change. The whole food plant base, you can get that to reverse in 21 days? Is that what you meant, or? The type 1? Type 1. Okay,
Yeah.
Type 1 diabetes is an autoimmune condition that affects the pancreas and kills the cells that produce insulin. So, if you have that problem, food can help you, yes, but you would need insulin. You need something else, because you don't have it because the cells that produce it dies or died.
So type 1 is not related to eating bad food or good food?
It's not related to it in its origin. It's related, it is in its treatment, because you can reduce your insulin requirements significantly when you eat well with type 1.
I'm going back to coconuts.
Coconut oil. Oil, just remember, there's
that's-
nothing wrong with the coconut water now.
No, I was going to ask about cooking with coconut milk.
I knew you was going to ask that. Somebody's going to ask that. Well, it's fatty, yes, but it's much. If you were to take, say, coconut oil, coconut milk, the grated coconut, or the coconut water, the water in the coconut water is better, is best, because coconut water is the best hydration ever because it has all the, it's almost like using an IV in a nut. And in India, they would actually stick an IV in it and give the patient through the vein. That is how good coconut water is for hydration when they don't have IVs. So it's very good. Now, the coconut milk wouldn't be as good as the coconut that you grate and put on because you're getting the fiber with the fat. And when you get the fiber with the fat, most of the fat tends to be excreted, by the way, when you get the fiber. So you can eat the coconut and you get the fat, some of the fat that gets excreted. But the coconut milk doesn't have as much fiber as the coconut itself. Except there was one coconut milk I bought that they tried to, they made the milk and they tried to put, make it in a way that they add the fiber in it. They incorporate the fiber in it, in the milk. That's okay. So if you do it, it's better than the oil, but just do it minimally. Some people don't want to do it at all, but I think it makes the food taste really good. So.
Amen.
Got a quick question. As it's the same one with coconut. So you can help me with this. I've seen where they have, they're saying, okay, it has saturated fats, but it's a different, the way the fatty chains are built, it's different from, let's say, an animal-based source. It's more like medium chain fatty acids.
Yes.
That's one. And then number two would be, especially from the Caribbean, where a lot, especially the poorer people, they'll live off the coconut. Have you seen any research to say heart disease was higher in that community?
I don't know if you were here at the very beginning, but I have a slide from the Pan American Health Organization that says that our prevalence of diabetes is 9% in the Caribbean.
Yeah, I did see that, but I was wondering if they could
I think it's because I think it's not only. I think it's because of multiple factors. I think it's complex, and I don't think it's all coconut. But we do. But I think it's the way we prepare our foods. The fast foods that are now in the community. Now we have created food deserts in certain areas of the Caribbean. And food desert mean people stop planting foods and they eating processed foods and things like that. But I have not seen any research to that. But speaking to the medium chain fatty acids, coconut has what they call medium chain fatty acids, as you say. Somebody's reading. That's good. But it can still increase your LDL. And it does increase your HDL too. So the reason why they say it's kind of between a rock and a hard place, because they said, okay, well, if it increases your HDL and increase your LDL, well, that's a wash there, because it increases your HDL and increases your LDL. But we're finding out that it also, the increase in LDL, well, let me back up. Initially, when we said increase the HDL, increase the LDL, then we said, well, it probably wouldn't do anything because it increases both. You know, HDL, as you know, is the good the protective cholesterol, and LDL is a bad one. Well, it increases both. The medium chain fatty acid increases both. But then we're finding out over the last few years that LDL is a problem. So in other words, whether it increase the HDL or not, HDL it's not as protective as we say it was. It's the LDL is the problem. So if it increases the LDL, it'll still increase your chance of having heart disease.
Thank you.
What about almond milk and oat milk?
Okay. Drink it. It's okay. Yeah. Yeah. Well, it's fatty, but some people say, and I've actually only read one thing on that, and it actually is less inflammatory than cow's milk.
Anybody else have a question?
Eat more pumpkin seeds. Eat more pumpkin seeds.
Pumpkin seeds. Eat pumpkin seeds, especially good for men, has a lot of zinc in it, improves testosterone, all kinds of stuff, so eat pumpkin seeds.
I was making a joke because on your farm.
Okay, on the farm, pumpkin, the seeds, you know what? What's so interesting about pumpkin seeds in the Caribbean? This is in Trinidad, by the way, that farm. I would take the pumpkin seeds out and try to wash them out and put them in the oven and all that. And people have no earthly idea they don't eat it. They don't eat it. They would eat the pumpkin. We eat a lot of pumpkins, and they would eat it in the morning. That's a big breakfast. Pumpkin, sautéed pumpkin. Yeah. It's cooked. They cook it. They saute it. They cook it. Yeah, and it gets all crushed up and mashed up. Yeah. Any other questions? If none, we. Yeah.
Oh, one last question.
You had a chart where you had the insulin receptor, and from what I'm understanding, you're saying that too much fat will have some sort of insulation to the insulin?
Yes.
And as a result, the glucose might be stuck outside with the insulin.
That's correct.
And I'm wondering, which is worse, having a high-fat diet for a diabetic, or which would be more detrimental, high fat with low carb or high carb with low fat? Which would be worse?
Okay, so that slide had what I said, insulin resistance. What I was looking at is insulin resistance and how it's caused. It is caused by high fat, high saturated fat, that is, because high saturated fats clog up those little receptors on the cells, especially the muscle cell. And now insulin cannot do the job of opening up these little receptors to allow glucose to go in. So it stays outside. So your insulin gets high and ineffective, essentially, and your glucose gets high. That's diabetes or pre-diabetes, depending on the level of which you go. So you have to unclog those insulin receptors to allow it to go in. Now, so you're talking about low carb. Do you know that a vegan diet is pretty high in carbs?
Yes.
A vegan diet is high in carbs. I mean, we do a lot of carbs. Like grapefruit alone had 13 grams of carbohydrate, one half a grapefruit. So it's a kind of carbohydrate we're looking at. So you want to do complex carbohydrates rather than simple carbohydrates like in sugars, for instance. So, just eat the food God made. That's what it is. Yeah.
Genesis 1:29.
That's right.
Okay.
Thank you.
Thank you so much, Dr. Perot. Thank you for. All right. So thank you all for coming and for participating, and ladies who came also a little bit late, thank you for coming too. That was great that you made it, for part of it at least. And so the audio on this, it's not perfect. That's why we were trying to play around with it. But it will be on, when Greg gets a chance, it will be on the Umatilla Church YouTube channel. So you can watch it or share it with a friend. Maybe listen to it first. Hopefully the audio isn't too bad that you think, oh no, I just can't listen to this. But anyway, Greg did his best, and so hopefully it'll be good enough to listen to again. So thank you all for coming. I'm hoping we can do something again in May. Would that interest any of you to, if we did something just to, it sort of encourages each of us, right, in our journey, because sometimes we're all in our little cells and we don't get a lot of encouragement from our surroundings. So it's kind of nice to come together and just talk about health and things that interest us. So it looked like quite a few of you are interested, so let's see. Just curious, I sent out a couple of emails. Did any of you see them? Okay, good. A couple of people did. That's good. Is there a better way than an email to reach out to you? Yes. Okay. And okay, so and there were two ways to participate. You could come for the potluck and bring something, you know, or you could just come at 2:30 just for the talk. Shall we keep it that way, you know, flexible, so whichever way people want to do is good with everybody? Okay. Okay, that sounds good. All right, so we'll work on something for May and see if we can pull it together. So thank you all for coming, and thank you so much, Dr. Perot. We really are grateful to you for sharing all your expertise with us. Thank you. All right, all have a good rest of the day, and we'll see you next time.